Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have BIRADS. What is BIRADS? BIRADS is breast imaging, reporting and data system. Okay. For BIRADS, we have 6 classes. Class 0. In class 0 there will be incomplete assessment will be seen. If there is incomplete assessment, then what do? We should do additional imaging is required. Additional imaging evaluation is required if there is incomplete assessment. Then category 1. Category 1 is negative. In negative assessment, if it is negative, then you can do a routine mammogram is done in 1 year is recommended. Then grade in category 2. Category 2 we will see there is benign findings are seen in category 2, and in benign findings then you do a routine mammogram is here also a routine mammogram is recommended in 1 year. Then 3, category 3 it is called as probably benign. In probably benign findings are seen. In probably benign findings you should do a short term follow up is recommended or is suggested. Then grade 4 it is suspicious abnormality is seen in grade 4. If there is suspicious abnormality in grade 4, a biopsy is considered. Grade 5. In grade 5 is actually highly suggestive of malignancy. If it is highly suggestive of malignancy, definitely you should do an appropriate action should be taken. Then grade 6. In grade 6 it is actually a known or proven malignancy. If it is a proven malignancy, known biopsy, through the biopsy itself, if we have proved that it is a malignancy, then what should you do? You should do treatment should be done.
thank you and thank you for watching.